Time to start the international session. Today is the 1884th day of uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1884th day of uninterrupted daily webinar of IFPH. Today, our guest speaker is Dr. K Srinivasan, visiting professor, Shivaraj Homeopathic Medical College, Salem. Dr. K Srinivasan is speaker of various conferences at Canada and India. He do have a practicing experience of 22 years. He is now practicing at Chennai and Salem. Let's welcome Dr. K Srinivasan for the session. And today our topic is Nephropathia Diabetica. I welcome you all for the session. Doctor, you can start.
Patient says, "Sir, I am a diabetic since 20 plus years. Sometimes I feel pain in my arms and legs. My muscles ache. As per doctor advice, I tried calcium, magnesium, and other such supplements. Nothing helped much. I feel quite weak. I also suffer from dry mouth. I don't know whether this dry mouth is due to this or other reason. My thirst is also very high, even in winter. Yet, sometimes there is burning in urinary passage while passing urine. My hunger is on higher end. I eat well and take care to drink adequate water. Yet, my stool is hard. I have to strain or take laxatives. I started losing weight, which is when I was diagnosed as diabetic. To my surprise, though I drink a lot of water, the urine output is less than before. I get frequent urging to urinate, but only little passes. Once, out of curiosity, I collected the urine in a plain glass bottle. I was startled and alarmed as it became like a cloud quite soon. So the case is taken in the usual way as it is taught in our colleges, how to take a chronic case. After patient narration, I try to encourage the patient to expand their each expression and to make it as complete and round possible. Then I try to verify which expression is more reliable. So from the entire case narration and this interaction and verification, this is what I feel more reliable and presentable. So only that data I am presenting it here for want of space and time. So step number 1, case taking and verification of data, which is more reliable and definite. Step 2, what I do is I analyze what patient told me and underline those very plain expressions or patient narration or symptoms which is likely to be present in our repertory and materia medica. And here I highlighted such points with red color for visibility. It is not gradation or mark. For better visibility, I have highlighted such points which I think will find its replica in repertory and materia medica. So we will go over the narration once again and see what is my analysis and how that is going to help in repertorization and materia medica study. So first highlight is diabetes. So the word diabetes we can find in repertory and materia medica. Second, pain in my arms and legs. So this we can find in repertory or materia medica as upper extremity, lower extremity, upper limb or lower limb, or limbs also, because all 4 limbs are involved. We can see this as a limb complaint in general also. Because the place where I practice and in colloquial language, patients say hand, which can mean from anywhere between upper arm, forearm, hand and finger. In the same way, feet, which can mean anything from hip to thigh, lower leg and feet and toes also. So I verify these kind of things and then write down accordingly. So second point is pain in limbs, arms and legs, or upper extremity or lower extremity. Then muscles aching, aching in muscles. So supplement calcium, magnesium, these things we will not find in repertory materia medica. So those points are not highlighted. I feel quite weak. So weakness. Next point is dry mouth. So anyone want to take photograph of this page? Yes, you can take photograph or screenshot if you're using a mobile, so that you can compare it when we go to materia medica study and comparison also. You can take a photo of this screen. I also suffer from dry mouth. Dryness of mouth is next point. And patient says he is having high thirst also. So dry mouth and thirst is high, but he is not sure whether these are correlatable. And he also observes that there is burning in urinary passage while passing. That means medically we translate this as burning urethra while passing urine. Okay, so usually such colloquial expressions are there in Materia Medica repertory. Sometimes a small medical translation will be a help. So here it's urethra burning while passing urine, and patient says, even though I take adequate care to drink water, still there are sometimes there is burning urination for no apparent reason. And patient says a comparison, my thirst is high even in winter. So this is one point I check with patients when asked about thirst, whether the thirst varies with season, with physical exertion, and in relation to the sickness, whether their thirst was before and how it is now after falling sick or close to that. So those differentiation I make and then I highlight. So dry mouth, thirst high, burning urethra while passing urine. And patient says, my hunger is also on the higher end. Hunger increased or excessive is another point. So these are the highlights. And then we go to the next screen. In spite of eating well and drinking adequate water, patient says, my stool is hard, I have to strain. So I'm not translating this as constipation because the understanding in my early years of homeopathy, from medical knowledge, constipation and diarrhea is entirely different from what rubrics available in repertory and Materia Medica symptoms available. So repertory is a very great help to learn case taking because every rubric and sub-rubric is a case taking point. That is how I learned how to take a case in a given situation, what to ask, what to observe, what to record. So repertory was a very great tool to enhance case taking skill. So when I open the repertory, we can say, for example, Kent repertory, I open constipation and see there are so many sub-rubrics and it is unique to homeopathy. These things we generally don't find as definitions or explanations in general medical books. Same with the diarrhea also. So here I leave it as such and not translating it as constipation. Stool is hard. I have to strain to pass. Okay. Then I started losing weight. So losing weight, one simple translation is emaciation. And then in spite of drinking lot of water, urine output is less. So here as a medical man, an alarm will signal whether patient tells me or not, patient is a diabetic, drinking lot of water, yet urine output is less. So most common thing I would suspect is whether kidney functions are impaired. If patient has done diagnosis, investigation, it is okay. Otherwise, we can suggest and get it confirmed where the patient stands. So this is one paradoxical point. Patient says, I drink lot of water, yet I pass less urine. So paradox is one like this, opposite. Patient says, I drink less water, I pass less water. It is of lesser sequence. Patient says, I drink lot of water, I pass lot of urine, it is of lesser importance. And also the opposite end. Patient says, say for example, doctor, I drink 1 liter water, I pass 6-7 liter urine. That is also a paradox which should attract our attention and take us to the reference book. Okay, so in this case, the paradox was patient says, I was drinking lot of water, yet I pass less amount of urine. And one more difference is patient often confound between the quantity and the frequency. So frequency is the number of times passed and quantity is the volume passed. So I verify what patient means by repeated questioning, twisting and turning them, and make them understand, and then come with reliable answer. The answer reliability. Why I go for reliable answer and cross check? The proving is done by masters who are brilliant and careful, also on people who are adequately careful enough and wise enough to observe themselves and report accurately. So those recordings are so accurate. Therefore, we compare things that are very definite in patient and from proving data. Okay, so therefore, at each step, I verify whether this is reliable, definite, then take it up and use for analysis and evaluation. So there is frequency in urging also, but at each passage, only small quantity is passed. And the next point is urine is collected, which cloud of very soon. So this is one more point which patient has observed. So it is not about village patient, educated, city patient, nothing. Patient is able to observe and report correctly, and on cross verification, they confirm it. It is fantastic. Even the clue to such a chronic case may be from a single point. A villager says, Doctor, I am a diabetic and I have one particular symptom. That's all. He says nothing else. It may be most characteristic, and that will open up the case. Okay. So I have learned to overcome my own mental blocks and prejudices, then my practice improve. So problem is within me, and when I overcome that more and more and more, the practice become more good. So the highlighted points are analysis. So third step is evaluation. When I go to a vegetable shop, say for example, let us see an anecdote. To buy a good tomato, I see the color, whether there is any worm invasion in that, and its consistency. That's how I evaluate a tomato and say it is a good tomato, I take. If I want to buy a lady's finger, I just press it tenderly, see that it is tender. Then if the shopkeeper allows, we break the tip and see it gently break. Then we evaluate that this is a good lady's finger I can buy. And third example, you go and buy a coconut, you take it and tap. A peculiar sound comes that shows it's a mature coconut. You shake it up, you see that the sound is coming. So it is not totally dry and it is good for cooking. So that is evaluation. In the same way, from all the analytical data I took from the case, I highlighted, I evaluate which symptom takes priority in this case, given this entire list of symptoms. So this one point I want to say again, there is no formula that works in every case that you take this symptom and the case is solved. So depending on what is present in each case, what takes priority will vary. So the rule for selecting tomato will not apply to select a coconut. Yeah. So in the same way, depending on each case, which symptom takes priority, which comes more first, which has to be there in the remedy, that will vary. And the commonest clue or the type of symptom I look for is a paradoxical symptom. Second is a distant concomitant. Third is a symptom with more components. What I mean by paradox, I told you example, that which is supposed to be present but absent. That is a paradox. And that which is supposed to be not present but it is there. The opposites. So I am drinking 6 liters of water but I am passing 500 ml urine. So that is something strange which should attract our attention. Patient says, I drink 1 liter water, but I pass 5 and 6 liters of urine. That should attract our attention. Patient says, my temperature is very, very high, but I don't want to drink even a sip of water. That should attract our attention. Patient says, I have shaking chills, rigor, but I want to drink a large bowl of ice cold water. During chill, someone wants to drink ice cold water. That is something paradoxical which should draw our attention first. Okay. So this kind of identifying a paradox, if present in the case, has yielded wonderful results in many difficult cases. So I look for a paradoxical symptom in the case and go to repertory and materia medica and verify. So first choice is paradox. Second is a distant concomitant. What I mean by distant concomitant, say for example, patient says severe headache, and whenever I get headache, I pass a lot of urine. It is not amelioration. There is a strange coincidence. Headache and accompanied by lot of urine. Whenever I get coryza, I get severe lumbosacral pain. So these organs and organ systems are anatomically placed far away, as well as they belong to different functional systems. Patient says, I have coryza and I have bitter taste in my mouth. So even though nose and tongue are placed closely anatomically, but taste is gastrointestinal and coryza is respiratory. So they belong to different functional systems. Therefore, it is of higher value. And patient says, the recent pandemic influenza and patient is having loss of taste and loss of smell. So loss of taste is of paramount value. Patient says, I have cough and I have loss of taste. So cough is respiratory, taste is gastrointestinal. So when such things are present, those symptom clusters in the patient, which are belonging to two different anatomical structures and two different functional systems, those symptoms are of higher value. I look for such things in the case. If it is present, my remedy should cover that point, and I refer with that. So that is second point of evaluation. Third one, symptoms with more component. So location, sensation, modality, concomitant, all that you know very well. Okay, so here the paradox is patient says, I drink lot of water, yet I pass less urine. So urine is decreased and it is related to thirst. So that search I did in the book, and then I read that remedy in the book. The match is very partial. So I quit that point. I will show it in repertory what I did. Here before closing this screen, I will show you what I took. So the next option I took is urine diminished in diabetes. Okay. I very rarely include the diagnostic names in my totality because those yield very less result. If we include diagnostic names in your totality, the results are partial and very short lasting. You have to change remedy, require more doses, and the results are only very short. And it doesn't give a wide range of result. Okay. So what I'm going to see in repertory is urine, diminished, and diabetes. So the website I use for my reference is homeoint.org. Homeoint.org. So you can capture this screen also, and we will study further up. Okay, so I'm closing the screen and open the website screen. So this is one wonderful website, www.homeoint.org. homeoint.org. You type the website fully, www.homeoint.org. This is wonderful. And here I raise the screen like this, and I locate constant and herring on the right side of the screen and guiding symptom. What displays for you is the herring guiding symptom materia medica, all 10 volumes remedies here as alphabets. and below that is NER repertory. And most three salient features of this NER repertory and Herring guiding symptom cluster all the repertories that I came across, including NER repertory, is a collection of several sources. Different references are there. But the difference with NER repertory and Herring guiding symptom, this one repertory has one layback materia medica. In colleges, they teach repertory is a reference, materia medica is the final authority. That after repertorization, you read materia medica, confirm the matching similarity of remedy and the patient symptom, then you prescribe. So when I use, say, for example, Kent repertory and work out the case, say Paris quadrifolia comes. Say, I don't remember whether Paris quadrifolia is in Kent materia medica. And if I read Kent materia medica, I don't find that match of Paris quadrifolia in his lectures. This is one practical challenge I face. So any repertory for that matter. So what I read in repertory and repertorial chart, one remedy comes. If I use that author's materia medica, I am not able to make the similarity or the match and prescribe with confidence. But if I use NER repertory and go to Herring guiding symptom materia medica, because Herring guiding symptom materia medica is the mother and NER repertory is the child. Exactly all that is there in Herring guiding symptom, you will find in NER repertory. Okay, so there is one layback materia medica where you can verify your repertorial result. You will find the match is there. So that is one advantage. Advantage number two, if you learn what is there in NER repertory, how to locate patient symptom in NER repertory, you don't need to attend any seminar or any conference, and you don't need any therapeutic tips, because there are thousands and thousands of single remedy rubrics in NER repertory. Very directly, what patient says, exactly in such common English words, you will find in NER repertory. Okay, so second advantage is thousands of single remedy rubrics. And third advantage, while compiling Herring guiding symptom, Constantine Herring took a decision. See, in my time and before, right from Hahnemann to my time, there are good number of proving materia medicas and journals publishing proving symptoms. So I will not do that again. What I will do is, I will publish a book which will contain symptoms that are removed in the sick individuals by using a similar remedy. Say, pulsatilla proving symptoms are there. Herring did not use all the proving symptoms of pulsatilla in his materia medica. Instead, he used proving symptoms of pulsatilla in patients on symptom similarity, verified that those proving symptoms of pulsatilla is removed in patients also on basis of symptom similarity. Those symptoms he collected and compiled as a materia medica. Okay. This work is being helped by many of his friends and colleagues and students and doctors across the world. And says another example, arsenic. I will not put all the proving symptoms of arsenic into my materia medica. If arsenic is given to patients on basis of symptom similarity, those symptoms which arsenic removed in patients, I will collect, verify, then I will publish as a Materia Medica. So this way, having published a Materia Medica, which is proving symptoms clinically tested and verified. Therefore, Herring guiding symptom Materia Medica is of highest value, and Herring lived only up to partial completion of volume 3. But he gave clear-cut guidelines, which is taken up by Charles Ra, Charles Moore, and Calvin Nair, and they completed 10 volumes, which include close to 500 remedies, little less than that. Okay, so this Materia Medica became one very authentic source, and H.C. Allen was a great contributor to the volumes of Herring guiding symptom, and he extracted those symptoms from his own experience also and published as Allen's keynotes. So that is one reason why the large number of Indian practitioners were able to logically use Allen's keynote are great success. Okay, so Herring himself has given a confirmed Materia Medica. Allen further confirmed it with his experience and published as a book. So three great advantage of Herring guiding symptom and their repertory. Number one, thousands of single remedy rubrics. So you don't go behind any therapeutic book or hint. And number two, there is one layback Materia Medica. What is there in repertory? You can go back to Materia Medica and verify. And this Materia Medica is a verified Materia Medica, clinical application, and found to be successful. Now we will look at what we are looking for. And these are on the left side of the screen is chapters and subchapters. And I am going to look at where the urine decreased diabetes is given. This website is wonderful. So after the session is over, please browse, explore it. It's very, very interesting. So here is our chapter, chapter 21, urinary organs. And the difference is urination is a process, urine is a product. Salivation is a process, saliva is a product. Lacrimation is a process, tears is a product. So here is urine. I opened subchapter urine and I will locate for urine decreased. Urine is diminished or decreased or scanty. So urine decreased, scanty. And here I want to look whether there is any subrubric that speaks about thirst is there, more, but urine is decreased. So under decreased, which is in red color, I look for thirst in blue color. With the thirst. So urine decreased with the thirst. So I went to this remedy Materia Medica and find whether there is any match with the case. The match is not there, and also I am not sure whether it is merely presence of usual thirst or increased thirst. Our patient is having increased thirst and drinking large quantity of water. So after reading this remedy, then I came back to repertory. Then I went to the rubric, urine diminished or scanty. And in diabetes. And I'm highlighting this, and the remedy is RAT. So what I do, then I don't know what is RAT. So the rubric is urine diminished, decreased in diabetes, and the remedy is RAT. I told you, there are thousands of single remedy rubrics in the repertory. So this is one example, and you can see other examples also in the screen. So what I do, I go to find out what is RAT, what remedy it is. So here is abbreviation expansion in the same website. And that is Ratania. RAT stands for Ratania. So the funny thing is, for several years, we commonly use Ratania for hemorrhoids, not more than that. So when I started reading NER repertory and proving materia medicas, all such therapeutic hints dropped away. And we can see the width and breadth of a remedy. Otherwise, we don't think of Ratania in a diabetes, that too with a urinary symptom. Okay, so when I keep my prejudice off, I'm able to see solutions much better and able to solve many cases. So then next step is, just because it is there in repertory, I will not prescribe it. I will go to here in the same page, you have Materia Medica. I go to Ratania Materia Medica, read it there, confirm whatever is there in the patient, whether it is present or not. So I open Ratania Materia Medica and select urinary organ. I will read out for you. And see what is the match of Ratania and the patient's symptom. Diabetes, considerable emaciation and weakness. So patient said, I started losing weight, which is when I was diagnosed as diabetic. And also patient said, I feel very weak. Limbs are sore and aching. Patient said, arms are paining, legs are paining. Great appetite, insatiable thirst, constant dryness of mouth, gums livid and swollen. This patient did not have. So what is present in Materia Medica, all that should be present in patient, I don't do. What all is present in patient, if it is having a good match in Materia Medica, that is enough. That is how I work. From patient to Materia Medica. Severe pain in small of back. So small of back is lumbar region by the side of lumbar vertebrae. So that region is called small of back. Ambulation from motion. Hard stool with straining. So patient said, even though I eat well and take adequate water, the stool is hard and I have to strain. So here I have not changed it into constipation, and exact match is there in the remedy. Frequent urging to urinate with the scanty discharge. This is also patient was having. And interestingly, the remedy is having the opposite also. Passes larger quantities of light colored urine. So our patient was having small quantity frequently and decreased output, but Ratania will help in diabetic patients who are passing large quantity and light colored urine also. Burning in urethra while urinating, incontinence of urine, frequent urging to urinate with scanty discharge, which soon becomes turbid and cloudy. So here, the urine when standing becomes cloudy quite soon. So patient qualifies that it becomes cloudy quite soon. So there is a good match. Not that every letter patient says I will find in Materia Medica, but a larger part, what I see in the patient, if it matches in drug, I will confidently give. Here, this is luckily largest part of what patient says is here. This is one rare case. This doesn't happen in large part of cases. Hardly 20-30% patients will have this kind of word to word match, but large part, what analytical and evaluatory points that I take, that will be usually there. Then I give confidently and the remedy works very well. So step 1, case taking. Step 2, verify data and take that is more reliable. Do analysis, find the facsimile or simulating things that is there in the patient, and you will find in plain English the same thing in repertory and meta-remedica. Point 4, evaluate which symptom is more important in this case compared to what other symptoms are present in the same patient, and then come to exact reference and look for it. And point 7, not only with repertory you prescribe, you come back to materia medica, read it out, and here overcome the prejudice by opening. See, retania is only rectal symptoms, hemorrhoids. No. It works wonderfully in these cases also. And then prescribe for the patient. On giving retania to the patient did very well. And here, not only diabetes, but any chronic disease patients, the common type of patients that come, patients who are already on medication and fresh cases. Okay. So the options I give to the patient is only homeopathy, and homeopathy, SOS allopathy, or combined therapy. You take allopathy, suppose patient is already on allopathy medicine, and suppose if I withdraw and my body respond very slowly to homeopathy, and if I develop severe symptoms, my life situation will not allow such discomforts. And so I want to continue allopathy also. I said, okay, you take both. And as patient gain confidence by result they feel in their body, not by mere doctor's word or any reassurance. Patient says, I was taking allopathy only, now I started taking homeopathy, and now my body has changed for much better. Now I can reduce or stop whatever. They stop it and then they do well. And we take the patient to that extent that they are able to take pre-diabetic diet. They are able to enjoy the sweets they are eating, yet the sugar level is normal. So that is the end point. Not that symptoms disappear, sugar level become normal, and patient put on very rigorous diet and tiresome exercise. No. Whether they do exercise or not, sugar level is normal. They eat sweets, still the sugar level is normal. That is the end point of treatment. Okay. So that is what I did in this case, and that is what we do with all chronic cases also. Discussions. So don't bother about potency or dosage. That you do, this is one method. The potency and dosage, you do whatever you are doing today. And then slowly you step up to new methods of potency and dosage. It is important. There is no secrecy for diabetes. This potency dosage works better. Nothing of that sort. Discussions, sir.
The forum is open for discussions.
Okay. So till question comes up. So the more I become silent observer, paying attention to even the smallest words and expressions of patient, that has helped me a lot in coming to right remedy. Prejudices, inattention, distraction, those are blocks and yield very poor result. So when my senses are alert, see, Dr. Sunirmal Sarkar present, I told the same case in a previous forum meetings also. One alcoholic patient, deeply jaundiced, gross ascites, pleural effusion, pedal edema in a very bad condition. He is practicing in Kolkata. He was brought to Sah's clinic. After case narration, patient's wife casually told, see, patient is walking with 4 men supporting him. And the lady casually told, doctor, he is having breathlessness while walking on the floor, level ground. But when he ascends the steps, there is no dyspnea. This is a paradox. So it is a very casual, just 10-second narration. One must be so always alert and sensitive and all his senses intact to every such expression that may come at any moment of the case taking. And on that basis, with exact reference in Kent repertory, Kent, respiration, dyspnea, while walking on level ground, not when ascending, the remedy was ranunculus bulbosus. And he gave ranunculus bulbosus, jaundice gone, pleural effusion gone, ascites gone, edema gone. Patient did very well. So these are learnings that is actually helping me to be alert, sensitive, watchful, unprejudiced, and open. So less and less my prejudice, more and more I am successful. That's a great learning. And there is exact reference always available.
Okay, here Dr. Dhanesh is with us. Dr. Dhanesh, you can ask.
Thank you, Dr. Vindraj, and excellent session, Dr. Srinivas. Sir, my question is, what was the turning point in your life to come to this repertory and this method?
I am usually an experimenter, sir. I explore. I keep learning things. So by chance, I came across this repertory, started exploring and using it and found very useful. So it is the basic bent of mind. You experiment, you explore, you try to improve your results. That is it.
Great, doctor. You coined the word paradox to the rare peculiar symptoms. So this is a right thing, and matching these things with the right medicine, selecting from the narrow repertory and opening the way how to reach to these things, unlocking what herring guiding symptoms is it's like a breeze sitting in your class.
Exactly.
So our masters had contributed a lot. They gave their life to homeopathy and everything is documented, sir. As Hahnemann says, truth is slightly covered over. You just swipe it, it stands in front of you. That's it. And most interestingly, several pregnant women contributed to the growth of homeopathy. They gave right to experiment on their own body and even on their infants. So we are so indebted and grateful to those people also. And there is a separate chapter in their repertory, pregnancy, lactation, parturition, where infants are also there. And for pediatrics and obstetrics, that is a wonderful chapter. And that in the year 1896, we should imagine, where medical advances are far different from what we enjoy today. The transportation, the technology, the emergency medicine, when those things are not there, and one death in the hands of homeopath, he is finished. 100 cases die with allopathy, nobody bothers. The story was similar in those days also. Yet, our people took those things and cured infants, pregnant women during parturition, all that.
Few more minutes to conclude. If any person to interact, they can raise their hands or they can put questions in the chat box.
So other advantages of nerve repertory, sir. Once a person becomes any question? Okay. Once a person becomes familiar where to see in nerve repertory, he can make a very, very quick prescription that will help in rural practice and in government hospital practice, where patient says, whether it is acute symptom or chronic disease, whatever, we need not bother acute or chronic. And village people, they say so plainly the truth and in such a simple language. And we find the facsimile exactly what they say in their repertory. I was astonished many a times. Very, very simple expression in a very chronic, troublesome case. And they had been to pillars and post, and they come to homeopathy in a GH setup also. And patient says in passing comment, and in 1 minute. And you see that exact match in their repertory. You give the remedy, case is solved. So rural practice and GH, it is a fantastic thing, as well as in emergencies. Because if the doctor has the knowledge and guts to take up emergencies, there are so many. Say, for example, you take heart and circulation chapter. You find so many emergency rubrics there, and all with one remedy. So if the doctor is skilled enough and have the heart to take up such emergency cases, their repertory is very, very helpful.
A question from Parvati Krishna. Sir, can we use nerve repertory in pathologically advanced cases?
Yes. I'll tell you one. The first question is, by reading medicine book and surgery book, we are all made impotent. A man is married to a beautiful woman, but he is impotent. Then it is neighbor's joy. So there was one Ellis Barker, who was a non-medical person who got trained with John Henry Clark. And he cured stage 4 cancer and made them live for 3 years, 5 years, 7 years, 10 years, 15 years. A non-medical person, he goes to Royal London Hospital cancer ward and discharge the patient who are stage 4 cancer, diagnosed and treated by allopaths, who are supposed to die in 15 days or 20 days. He discharged them, bring them home, treat them with homeopathy and made them all right. So prognosis, never think. Our only job is take the case of the patient in front of you, exact reference, give the remedy, wait and watch. That is the only rule, doctor. Leave alone whether it is cancer or any disease. Don't say the word prognosis. Never. Okay.
More questions, please.
We can team up, sir. One, see, we have to learn few things from allopathy. Leave alone why they do reference. But the reference is one thing where patient get better care. Leave alone other things, hidden things in that. But patient get a better care if they go from primary care to secondary care to tertiary care. And what is not possible to treat in primary care, they are able to produce good result at tertiary care hospitals or tertiary care physicians. In the same way, see, in this forum, there are good number of doctors, and it's a mixture of levels of homeopaths. So if you're at one level and you are not able to solve a case, refer it to a next level doctor or next level doctor. Sit with them, you learn with them, and that is a learning to you and a help to your patient and good for homeopathy also. So reference is one good technique to learn and help patient. Let's work as a team.
Definitely so. And these days, doctors are dealing cases, patients reaching diseases in the materialistic world view only. They are using battery of tests and everything to see, to find diseases and to unlock the disease itself. And with homeopathy, it is not like that. And in present time, junior doctors and even senior homeo doctors also, we can see in our forum also, when they are presenting cases or webinars, we can see doctors reaching homeopaths, reaching the cases, finding medicines according to the principles, leaving the principles and viewing it through the materialistic point of view only. And apart from this, I was just mentioning that this class is like a breeze, and it easily with a magic wand you placed everything in order. So it's great, sir. You can say a little bit more.
Good to know that, sir. Thank you. Next Malayalam session time.
Yeah, it's time to conclude, and I welcome Dr. Tanesh to say the vote of thanks. Doctor,
Yes, as Dr. Binduraj pointed out, it is just like a breeze that we never felt such a breeze in this forum like this, because that was mentioned by Dr. Sheila here in her comment also. So we need this kind of presentation to not only simply motivating homeopaths, but also it really, you really show the way how to study materia medica, how to use the materia medica, how to use the repertory, how to correlate the symptoms with in the patient with the repertory, and how to correlate the repertory with the materia medica, the simillimum with the repertory, and all those there were in the Returnia. We never thought that Returnia will be the medicine to be choose, but that kind of a beautiful presentation, and not only that, you all in all you get the result also with that same medicine. And that's what the beauty of homeopathy. And you really talk from inside, not from outside. You simply you even advise whether the patient is taking allopathic medicine, do not disturb him, but just give your homeopathic medicine. And then once the patient get the confidence, then he will automatically demand for reducing his medicine, and thereby gradually he can withdraw allopathic medicine that way, and thereby homeopathy it can be established in that particular patient also. And thank you for the excellent session. We know that you have presented so many sessions in this forum. All were brilliant, but today's is exemplary brilliant one. And thank you, sir. Thank you, doctor, for coming over here and making such a presentation. Hope we can have some more, at least one presentation every month, so that all of us can study and work together to move forward. Thank you, sir.
thank you all. And it's time to